Abnormal Psychology BA 6th semester session 32. Today topic is microcephaly and hydrocephaly. But most little language development and are extremely limited in mental capacity. Microcephaly may result from a wide range of factors that impair brain development, including intracranial infections and pelvic irritations during the mother's early months in pregnancy. According to Miller, he noted a number of cases of microcephaly in Hiroshima and Nagasaki that apparently resulted from the atomic bomb explosions during the World's Second World War. The role of genetic factors is not clear, although there is a speculation that a single recessive gene is involved, primarily inherited from the disorders. The symptoms of microcephaly is delayed development such as learning to speak, stand, sit, walk and later age than other children at the same similar stage, learning difficulties, movement and balance issue, eye prescribed, issue with the feeding such as difficulty swallowing, reduced vision from lesion on the retina. The area at the back of the eye distorted facial features of expression. The diagnostic process of microcephaly is included in physical exams and evaluation of age circumstance, family history, and exercise and parents starting head growth over time. The treatment, there is no treatment or cure is currently available for microcephaly. Instead of treatment, we have to focus on managing the condition, relieving the linked health problems such as seizure. If an ongoing process is contributing to the microcephaly, such as the malnutrition, healthcare professionals will also address this in time. With mild microcephaly, typically only require routine checkup. In however, is a condition require early childhood intervention program is strengthen their physical and intellectual capabilities. Hydrocephaly. Hydrocephaly, the condition is referred to hydrocephaly, is a relatively rare disorder in which the accumulation of abnormal amount of cerebrospinal fluid within the cranium causes damage to the brain tissues and enlargement of the skull. In cognitive cases, the head either is already enlarged at birth or begins to enlarge soon thereafter, presumably as result of a disturbance in the formation, subscriptions, and circulations of the cerebrospinal fluid. The disorder can arise in infancy or early childhood. The following development of a brain tumor, subdural hematotor, meningitis, or other condition. In these cases, the condition is appeared to be result from a blockage of the cerebrospinal pathways and an accumulation of fluid in certain brain areas. In a clinical picture, of hydrocephaly depend on the extent of the neural damage, which in turn depends on the age and onset of duration. The severity of the disorder. In chronic cases, the chief symptoms of gradually enlargement of the upper part of the head, out of proportion of the face, and the rest of the body. The explanation of the skulls help minimize destructive pressures on the brain. Seriously, the brain damage occurs unless this damage leads to intellectual impairment and such other effects of convolutions and impairments are loss of sight and hearing, the degree of intellectual impairment is varies being severe and profound in advanced cases. Hydrocephaly can be treated by a procedure in which shunting device inserted to the drain cerebral fluid. With early diagnosis and treatment, this condition can usually be arrested before severe brain damage has occurred. Even with a significant brain damage, carefully planned and early interventions that take into account both strength and weaken and intellectual functioning may minimize disability. So these are the reference. We are taking all the information from Anna, Butcher and Woody, Susan and Nolan Wisman, James and Sil.